want to raise your hand, for example, to combine, this muscle is active. So trapezius is active in elevating, in depression, and in adduction. You can hear this muscle depression, this muscle adducting, this muscle elevation. Okay? Now, what about the innervation?
That's from
One of the cranial nerves.
level
Which one?
11 to
11.
accessory.
Accessory nerve. 11. Cranial nerve is responsible to nerve. You are at exam. I ask you, all of the following exam, none of the following muscles are going to attach to the first thoracic vertebra except what about the pectoralis major, pectoralis minor, trapezius. This trapezius attached to the T1.
No.
Why no?
Yes.
I
Do you
told
want it
you
to work?
all of the spinous process of the thoracic vertebra. The spinous process belongs to the thoracic vertebra. Okay? So all of the spinous process of thoracic vertebra is the place, the area for attachment of some of the muscle fibers that belong to the trapezius. Now, another muscle that it is visible here and is so broad and large muscle is this muscle. What's the name of this muscle?
Latissimus
dorsi. Latissimus dorsi. We can do this broad and large muscle. What about the origin? To be able to remember the origin according to the picture.
lumbar.
They are going to attach some of them to attach to the sacrum, to the iliac crest, anterior part of the iliac crest or posterior part. Posterior. To all of the spinous process of the lumbar region, and to the inferior 6 spinous process of thoracic vertebra. Okay? So inferior 6 thoracic vertebra, the spinous process. Some of the muscle fiber are going to attach, latissimus dorsi. So to the inferior 6 spinous process of thoracic vertebra, all of the spinous process of lumbar vertebra, to the posterior part of iliac crest, sacrum. And later, I am going to explain for you about a fascia that we call thoracolumbar fascia. Later, I am going to explain for you. The thoracolumbar fascia also is an area for attachment of some of the muscle fibers that belong to latissimus dorsi. This latissimus dorsi here, posteriorly, is coming up and come anteriorly. You remember the intertubercular groove here, which muscle connect or attach to lateral border?
Pectoralis major.
This pectoralis major, this latissimus is coming and attached to the floor. Attached to the floor. Can you remember the tendon of which muscle is passing here? Not long head of the biceps. It is only passing, not attachment. The lateral border of intertubercular sulcus or groove is the side area for attachment of pectoralis major. The floor is the area for attachment of latissimus dorsi. Now, what about the innervation? One of the nerves that belong to brachydactyls. What's the nerve? Thoracodorsal. What's about the function? This muscle, when you are going to drive or run the boat, okay? This board, this position, this muscle is so active. Means the latissimus dorsi. One of the functions is extension, adduction, and medial rotation. Extension, adduction, and medial rotation. Here exam, it is possible I will ask you about the function of this muscle. In your exam, it is possible I ask you, all of the following muscle has attachment to the 11 thoracic vertebra except What about the latissimus dorsi? Yes. What about the trapezius? Yes. What about the, for example, the first major? No. Now we remove these two muscles, trapezius and latissimus dorsi, to be able to show you another muscle in the back. If I remove the trapezius, stick to trapezius, I will be able to introduce to you three muscles: levator scapula, rhomboid minor, rhomboid major. Levator scapula, rhomboid minor, rhomboid major. It is the medial border of the scapula. Do you agree? What's another name of this border? Vertebral border. It's near the vertebral column. Vertebral border or medial border of the scapula. These three muscles inferiorly attach to medial border of the scapula. Now, if we imagine, here we have the scapula, okay? Here, imagine the scapula in this medial border. It is the superior angle. This superior angle is the area for connection of levator scapular muscle. This levator scapular muscle superiorly is going to connect the transverse process of the first four cervical vertebrae. Inferiorly is coming to connect to the scapula. Which part of the scapula? Superior. What's the function? The name of the muscle, remember, levator scapula. Elevation scapula. This muscle, what's the name? Rhomboid minor. And if there's rhomboid minor, rhomboid major. To be able to remember the rhomboid minor, rhomboid major, imagine the rhomboid major is the mother and the rhomboid minor is the baby. The rhomboid major hug the rhomboid minor. We come laterally. Here we have tres major, tres minor. Okay, again, the mother is inferior, not the baby. So medially, laterally, rhomboid major, tres major. Rhomboid minor, tres minor. Now look at the rhomboid minor. Rhomboid minor is here, and rhomboid major is inferior. You know here we have the spine of the scapula. Yes? Here we have the spine of the scapula. What's the name of this area? What's the name of this? Which of them is larger? Now, medially, exactly at the root of the spine here, we have attachment of rhomboid minor and medial border. Inferior to attachment of rhomboid minor, we have rhomboid major. Now about the origin. Imagine, here we have ligamentum noted, here is the C7, and here is the T1. So this muscle fiber attached, this muscle fiber attached to inferior end of the ligamentum noted, spinous process of C7 and the spinous process of T1. Okay? Ligamentum noted, the spinous process of C7 and the spinous process of T1. This origin of rhomboid minor. What about the insertion medial border near the root of the spine? What about the rhomboid major? The rhomboid major has some connection to the spinous process of T2, the spinous process of T3, the spinous process of T4. Now we have variation. Sometimes the feet bypass, but T2, T3, 4. Okay? Now, imagine about the function. Rhomboid minor, rhomboid major. What's the function? Retraction. When they are going to contract, they take medial border of the scapula near the vertebral column. Okay? So when you are going to sitting on the bed for a long time, over this you come anteriorly. Okay? You are going to make weak rhomboid minor and rhomboid major. It is better after some time to stand up and do some exercise, contract the rhomboid minor, major border of the scapula with contraction, go near the vertebral column and elevate. When the major border adjust, elevate, what happened to the lateral border? What do you think? It is the scapula. Medial border, lateral border. Here is the glenoid surface. The contraction of the rhomboid minor and rhomboid major, it elevated. What happened to the lateral border? Rotation, downward. Here go upward, the other side come downward. When you put or hand or pick up the hammer and wanted to bring down, these two muscles are so active. They are going to rotate the glenoid surface. Okay? And to be able to stand upright, these two muscles help you. And we should try to strong these two muscles to be able to stand upright. Very complicated. And what about the innervation? These three muscles, remember dorsal scapula. Dorsal scapular nerve is coming down deep to these three muscles, innervate this, and innervate these three muscles. What's the innervation of latissimus dorsi? Dorsal, thoracodorsal. What's the innervation of these three muscles? Dorsal, they are defense there. Never make mistake. Dorsal scapular, thoracodorsal. Dorsal scapular, thoracodorsal. Now, if I remove these three muscles in each side and remove the latissimus dorsi, I will be able to show you another muscle. Here, we remove the skin and superficial fascia. I am able to show you the trapezius, latissimus dorsi. In the other side, I remove the trapezius. Into trapezius, I am able to show you the levator scapula, rhomboid minor, rhomboid major. Okay? Trapezius are visible here, latissimus dorsi are visible here. Now, if I remove the latissimus dorsi, such as this picture, if the latissimus dorsi, I am able to show you posterior, inferior serratus muscle. Posterior, inferior serratus muscle. And if I remove this rhomboid, deep to this rhomboid, I will be able to show you the superior, posterior serratus muscle. You can see here, superior, posterior, inferior, posterior serratus muscle. These two are different from the serratus anterior muscle. You remember serratus anterior muscle? What's the function of serratus anterior? It is the main. It is the main. What's the function of the pectoralis minor protractor? The main muscle for contraction is the serratus anterior. Okay? The main muscle that is responsible for contraction of the scapula is serratus anterior. For serratus anterior, if you put both hands on the wall, normally the medial border of the scapula should be such as this. But if this muscle in each side gets paralyzed, the medial border of the scapula goes backward, such as the butterfly. We call scapula anatom. We call winging of scapula. I'm going to show you some pictures. You at here. Normally, the serratus anterior in this side is normal. But in the other side, you have the paralysis of the serratus anterior. So medial border of the scapula, this side go backward. We call winging of scapula or scapula alatum. Winging of scapula or scapula alatum. Why the winging of the scapula appear? Because of paralysis of the serratus anterior muscle. Serratus anterior muscle is different muscle. In the back, I'm going to introduce to you two muscles that we call serratus posterior superior and serratus posterior inferior muscle in this side. The serratus posterior inferior is mid to the latissimus dorsi. Serratus posterior superior is deep to the rhomboid minor, rhomboid major, and levator scapula. About the origin and insertion of these two muscles, it is easy. Look at and compare the direction of the muscle. Which of them, the muscle fibers are coming down? Superior, posterior, serratus muscle. Which of the muscle fibers going up? Serratus posterior inferior muscle. This white sheet is going to remember you the trapedorsal membrane. Trapedorsal membrane, later we are going to speak about that. Trapedorsal membrane is a place, an area for attachment some of the muscle. One of the muscle that I explained for you, if you remember, I told you the latissimus dorsi, some of the fiber attached to thoracolumbar fascia. Where is the thoracolumbar fascia? This white sheet fascia. The serratus posterior inferior also have some attachment to thoracolumbar fascia. In your exam, it is possible to ask you which of the following muscle has connection, has attachment to thoracolumbar fascia. You should remember the latissimus dorsi, you should remember the serratus posterior inferior muscle. Okay? Now, about the serratus posterior superior and serratus posterior inferior. Look at the picture. It is ligamentum nuncle C7, and here we have T1, T2, T3. About the serratus posterior superior, it is going to connect to T7, T1, T2, T3, and a little attached to ligamentum nuncle. The muscle fibers are going downward and lateral. They are going to connect to some of the rib. Which rib? The second rib, third rib, fourth rib, and fifth rib. So it is on rib. About the serratus posterior inferior, remember here we have T11, T12, L1, L2, L3. Normally, the serratus posterior inferior is going to attach to a spinous process of T12, L1, L2, L3. Okay? And in the other side, we are going again to attach to the rib. Which rib? 9, 10, 11, and 12. Okay? Now you understand. I'm going to ask you, all of the following muscles, please pay attention. All of the following muscles are going to attach or connect to T12 except posterior inferior serratus muscle has connection. Trapezius has connection. Latissimus dorsi has connection. Okay? What about, for example, the T1? The rhomboid minor, yes. The serratus posterior superior, yes. The trapezius, yes. Your exam, the you are a medical student. I never asked you what's the name of this muscle. You know, it is so easy. I'm going to ask you some questions about the attachment in the origin or in the insertion. You know all the things. Only you should summarize in your mind. All of the muscle fiber has attachment to the rib, except to the rib. Posterior superior serratus muscle has attachment. Posterior inferior serratus muscle has attachment to the rib. Pectoralis minor has attachment. Pectoralis major, no,
No.
to the costal cartilage, not to the rib. What about the trapezius?
Yes. Yes. What?
Which one?
No.
Trapezius, I told you, trapezius is visible here. Trapezius has attachment to a skull, the spinous process is cervical, to the spinous process of the here to the scapula, to the clavicle. Do you remember I told you some muscle fiber attached to the rib? Rib?
No.
No. So repeat, and look at the picture. The questions are so easy. Only you should read carefully and more to be able to distinguish and to remember everything. Do you have any questions? No. We remove all of the muscle in the back. We remove all of the muscle in the back to be able to show you this thoracolumbar fossa. Imagine you remove this serratus posterior superior and serratus posterior inferior too. Look at this muscle. This muscle is visible posterior to the neck. This muscle we call splenius. We call splenius muscle. In each side, it is visible. The serratus posterior superior, the serratus posterior inferior, they are going to be innervated by the intercostal nerve. To be able to summarize and get in your mind, you can hear the serratus posterior superior is going to be innervated by the second, third, fourth, fifth intercostal nerve. The serratus posterior inferior is going to be innervated by the 9, 10, 11, 12 intercostal nerve. Okay? I'm going to summarize, classify, to help you to get in your mind better and quickly, fast. The insertion help you to remember the innervation, here and here. Now, all of these nerves are ventral branch or anterior branch, because when we are going to explain for you, it is the spinal cord. We have 31 pairs of the spinal nerve. When they are leaving the vertebral column and come out, very soon we want to branch, ventral, dorsal, ventral, dorsal. Okay? This ventral branch are going to make it for us, for example, the intercostal nerve. And the ventral branch are responsible to innervate the serratus posterior superior, serratus posterior inferior. Which branch of the intercostal of the spinal nerve are responsible to innervate the serratus posterior, serratus superior, inferior? Anterior, ventral branch. The anterior, the ventral branch means here. It is the anterior, here is the posterior. The anterior branch of the spinal nerve is responsible to innervate this muscle. All of the muscles that I explained for you are going to be innervated by the anterior, by the ventral branch. Now, from here, all of the muscles that I am going to explain for you, they are going to be innervated by the dorsal branch. One of them is splenius. It was one of the questions I told them. All of the 40 muscles are going to be innervated by the ventral Serratus posterior inferior, serratus posterior superior. For example, another muscle, the transverse thoracis, all of them. Intercostal muscle, ventral. What about the splenius? Dorsal. And if I remove all of this muscle, I am able to show you two columns of the muscle we call electrospine. Have you ever heard about the Iranian kebab or Turkish kebab? Yes? Which part of the body of the cow or sheep is better for kebab? Electrospine. Okay? Near the vertebral column. Okay? We call electrospine. Near the vertebral column. So if I remove the thoracolumbar fascia, if the thoracolumbar fascia I will be able in each side of the vertebral column explain for you some of the muscles. They are such as the column, such as the root, and we call electrospine muscle. All of the electrospine muscles are going to be innervated by the dorsal branch of the spinal nerve. All of the muscles that belong to electrospine are going to be innervated by the dorsal branch or posterior branch of the spinal nerve. Okay? So just now the splenius and all of the piece of the electrospine muscle are going to be innervated by which branch of the spinal nerve? Dorsal or ventral? Dorsal. Never forget. Now, before I explain the electrospine, it is better I explain a little about the thoracolumbar fascia. It is a transverse section from the lumbar region. In this transverse section, with a green color, I am going to remember you and to show you the thoracolumbar fascia. It is the lumbar vertebra. What is this? Spinous process. What is this? With the transverse process and the spinous process, in each side we have a notch, we have a column. Inside of this column, in each side, we have the mass of the muscle that we can call electrospine muscle. In the right side, in the left side. Electrospine muscle is a mass of the muscle, not only one muscle. A lot of muscles are going to form the electrospine. Later, you are going to know them and be familiar with them. Now, this green layer that we call thoracolumbar fascia. Thoracolumbar fascia consists of three layers. Look at the picture aspects. Consists of three layers. Here, I am able to show you the posterior layer, middle layer, and anterior layer. So, thoracolumbar fascia consists of three layers: posterior layer, middle layer, anterior layer. Posterior layer, middle layer, anterior layer. Okay? The posterior layer medially connect to the tip of the spinous process. They are passing laterally in each side, behind of the electrospine muscle, and lateral to electrospine muscle. They are going to connect to the middle layer. Okay? Anterior to the electrospine, we have middle layer. This middle layer medially connects to tip of the transverse process. This layer passing anterior to electrospine, and laterally it is going to connect and join to the posterior layer. We get that? It is easy. According to the picture, I am going to explain for you. This green sheet we call thoracolumbar fascia. Normally, in the lumbar region, thoracolumbar fascia on each side consists of three layers: anterior, middle, posterior. Posterior layer is visible here. Superficial to this muscle. What's the name of this muscle? Electrospine. superficial to the erector spine, lateral to erector spine is going to join to middle layer. Middle layer medially connect to the transverse process, and the middle layer pass anterior to the erector spine, lateral to erector spine join to posterior layer. Now anterior layer of the trochilumbar medially attached to the transverse process. This time it is passing anterior to this muscle. Posterior wall of the abdomen, we have some muscle. One of the muscle is visible here. We call quadratus lumborum. Quadratus lumborum. The anterior layer of the trochilumbar fascia medially connect to the transverse process. It is passing anterior to quadratus lumborum. You are at exam. I am going to ask you, which of the layer of trochilumbar is passing anterior to the erector spine muscle? Middle layer. Which layer is passing anterior to quadratus lumborum muscle? Anterior layer. Which layer of the trochilumbar is passing posterior to erector spine? Posterior layer. All of them lateral are going to join together. This trochilumbar fascia, look at here, it is a cross section from the latissimus dorsi. You remember I told you the latissimus dorsi origin have some attachment to trochilumbar fascia. Here is visible. It is trochilumbar, and some of the muscle fiber that belong to the latissimus dorsi is near this trochilumbar that they are going to connect to trochilumbar. They are the three layers of the muscle in the abdomen. Look at here. The transverse abdominis is going to have connection. So transverse abdominis connection has some connection to the trochilumbar. The latissimus dorsi has some connection to trochilumbar. Also, this muscle, what's the name of this muscle? Serratus posterior has some connection to the trochilumbar. Three muscle I told you. Posterior serratus inferior muscle, latissimus dorsi, transverse abdominis. They are going to have connection to trochilumbar fascia. What's the function of this trochilumbar fascia? They are going to organize and protect and keep the erector spine muscle. They are going to organize. Okay? Now, we go back here. We are going to explain a little more. Here we are going to look at to the erector spine. Erector spine in this side consists of three layers. Erector spine in each side consists of three layers. Superficial layer, middle layer, and anterior layer. In posterior layer of the erector spine, we have three columns of the muscle. We can call iliocostalis, we can call longissimus, and medially we can call spinalis. Spinalis, longissimus, iliocostalis. It is easy. In your book, all of the book, it is possible to find some explanation about the origin and insertion of these groups. You don't need to read and get in your mind. Only something that I am going to explain about the erector spine is important for this semester. In your exam, only to know the name of these groups, we call iliocostalis. Medial to iliocostalis, longissimus. Medial to longissimus, spinalis. Only the name is enough. You don't need to know the subdivision, the origin, the insertion of this. Okay? Only you know the superficial layer of the erector spine consists of three groups of the muscle in each side. Which of them the position is lateral? Iliocostalis. Which of them the position is medial? Longissimus. Which of them is near the vertebral column? Okay? Now, if I remove this superficial layer, if I remove this superficial layer in your exam, it is possible I put this picture and ask you to name. What's the name of this lateral? Iliopostern. What's the name of this? Longissimus. What's the name of this? Estimus. You should know that all of them has a lot of subdivision. You don't need to understand. You don't need to get in your mind. Inshallah, in the future, when you become a surgeon, yes, that time you should read about all of this erectile spine muscle in detail. But now you are going to be jiffy, empty, so you don't need to. It is up to you. It is possible you would love to read, but I'm not going to ask you at the final exam. Okay? Now, what is this picture going to tell to you? It is iliopostalis, longissimus, spinalis. On the other side, this black line are going to remember the origin and the inception of this. But you don't need to. If I remove this superficial layer and go deep, I will be able to show you another muscle. One of them is visible here. We call multifidus. Another one we call, this is the multifidus. Another one we can call rotator, the rotator of the fossa. Another one we can call the rotator of the fossa. We have a lot of subdivision, and superiorly I am able to show you another muscle we call semi-spinalis, the multifidus, semi-spinalis, the rotator. All of them are going to find deep in the erectile spine mass. And the deepest layer, I am able to show you levator-posterum, I am able to show you intertransverse, I am able to show you interspinous. So you know in each side, the erectile spine consists of 3 layers, the superficial layer consists of 3 columns, iliopostalis, longissimus, spinalis. If I remove the second layer, we have multifidus, semi-spinalis, rotator. If I remove, I will be able to show you the interspinous muscle, intertransverse muscle, and the rotator fossa. All of the muscle in erectile spine are going to be innervated by the posterior or dorsal branch of the spinal nerve. It is important. It is important. All of these muscles head to your vertebral column direct to stand upright. If this muscle gets weak, you are going to make care. Okay? You are going to head to extension. Do you have any question? Now you know everything. And here, look at this picture. We name the muscle. What's the name of this muscle? 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 Levator scapula. What's the name of this muscle? Rhomboid minor and rhomboid major. Okay? And here we are going to look at rhomboid major, rhomboid minor, and levator scapula. What's the name of this muscle? Posterior, inferior, and during the sitting, they are going to remember you all of the muscle. Here, you are at exam. It is possible I put this picture. It is erectile spine, the superficial layer. Iliopostalis, longissimus, spinalis. Which of the position is medial?
Longissimus.
Spinalis. Which of them the position is lateral? Iliopostalis. Exactly, medial to iliopostalis. Which of the following muscle is visible? Longissimus. again here, we can here. I told you it is the iliocostalis, it is the non-gismus, it is the spinalis, which is known we have a lot of subdivision. For example, we can call iliocostalis lumbarum, iliocostalis thoracis, iliocostalis cervicis. We don't need to do it. Only I put this picture to explain that we have something in the top.